Turn to Dr. Maia Tsereteli, who's the head of the Division of HIV/AIDS, Hepatitis TB, and STIs at the National Center for Disease Control and Public Health in the Republic of Georgia. She graduated in Public Health and Healthcare Management at Tbilisi State University. She's led a variety of different projects, including the CDC supported HCV elimination program in the country. She's a member of the State Scientific Committee on HCV elimination, and since September of last year, she is the co-head of the WHO Collaborating Center on Viral Hepatitis Elimination in Tbilisi. Welcome.
Hi. So first of all, I also would like to thank you, Dr. Chan, for inviting me and for the opportunity to share achievements and challenges of ongoing HCV elimination program in Georgia. Thank you very much. So, yeah. Before 2015, actually, we did not have precise information about the prevalence of HCV in Georgia. So we were conducted some studies, just a few studies, but so among IDUs. So in 2015, we decided with technical support from CDC and in close collaboration with WHO, we conducted the population-based survey to identify the prevalence of HCV and so clear risk factors. So as you can see on the slide, so based on this survey, based on the results of this survey in 2015, Georgia was among countries with the highest prevalence of HCV. So anti-HCV prevalence was 7.7 and RNA prevalence was 5.4. According to these figures, so in 2015, we had approximately 150,000 people with chronic disease. Even in some regions, the prevalence was even 8.8 and 9%, especially in Western Georgia. Sorry. Oh. How can I just get back? I'm sorry. Red? Oh. Yeah. So in this slide, I have the main events and main achievements since 2015 to 2022. But so I will provide you with detailed information following slides. So in 2015, so the Georgian government, based on results of the conducted sero survey, so initiated the very, very ambitious program to eliminate HCV by 2020. That's with our, in collaboration with CDC, with WHO, and with pharmaceutical company Gilead. So the first step to start the elimination program was development of the strategic plan. The strategic one was developed for 5 years, for 2016 to 2020, and so with the 6 main directions: to improve public awareness, improve prevention of transmission, improve laboratory diagnostic, care and treatment, and surveillance. In 2021, so we developed the second strategy, but it's, as was decided by the Ministry of Health and the government, this was not only for HCV elimination, but for both viral hepatitis elimination. So the difference between these two strategies, in the new strategy, we have some elements of hepatitis B. As based on a decision, we started to work on HPV elimination as well. Yeah. So in 2021, we conducted 2 estimate the progress of the ongoing program, we conducted the second survey. And so, as you can see, results on this slide. So, in 6 years' time, the prevalence of HCV infection has decreased by 67%, from 5.4 to 1.8. I'm sorry. And so the main result is that we have an estimated number of about 50,000 people with chronic HCV infections remaining. We have very interesting results, not only on HCV, but on about HPV as well. Because as you can see, so we have very low prevalence among children. It's 0.3. That's very low to compare to adults, and this also indicates the very good successful implementation of vaccination program in Georgia. Okay, so when we started in 2015, so we have very ambitious targets. So 1995. That means that so we planning to diagnose 90% of people living with HCV, and in absolute numbers was 135,000 people. So to treat 95% of those who diagnosed, and to get a cure rate 95%. So what achievement since 2050? So for now, so we have conducted 6.5 million screenings, over 2.9 million persons tested, about 160,000 positive cases identified, and over 82,000 patients started the treatment, and with cure rate 99%. So what's our new targets according to the new strategy is to diagnose remaining 28% of people, treat remaining 36% of infected, and cure remaining 37% of those who are treated. Here you can see the care and treatment cascade from April 2015 till May 2023. So the figures I already mentioned, but so I would like just to mention about some just kind of challenges what we are facing now. So we have about 20,000 persons who are anti-HCV positive, but we cannot get them to the confirmatory test. And so we have about 15,000 people who are RNA positive, and so we cannot enroll them in the treatment program. Now I would like just to briefly tell you about our main achievements. So as I mentioned already, since 2015, so we developed and implemented country strategic plans, as well as different clinical guidelines and laboratory steps to support viral hepatitis elimination. We conducted 2 nationwide surveys to estimate and monitor the progress of the burden of viral hepatitis infections. Since 2015, Georgia has scaled up the screening and treatment services, achieving impressive results. And so the one very important step was to establish infection prevention and control monitoring and evaluation and medical and non-medical facilities. So we started, that's one of the very important tools. So we started the program with massive PR campaigns to improve their awareness, the people's awareness about the available treatment process. So we created the integrated electronic registries that helps us to monitor screening and treatment. Very important for successful implementation of this program was decentralization of testing and treatment. When we started in 2015, we had only 4 clinics, 4 treatment provider clinics in Georgia, and that was only in Tbilisi, capital city. But now we have more than about 40 centers, including the penitentiary system, of course, and now we have even at harm reduction centers. Screening is widely accessible in multiple settings, hospitals, harm reduction centers, primary healthcare settings. So one of the very successful was innovative approach to conduct integrated screening on TB, HIV, HCV. Currently, point-of-care viremic testing initiation of HCV treatment are free of charge and widely available. All blood donations are screened for HCV and HPV using nucleic NAT testing. Very important achievement was to establish clinical and scientific committees in the frame of the HCV elimination program that help us to coordinate different operational research and different activities. Since 2019, so the 90 proposals were reviewed and 75 approved, and a lot of clinical guideline for management hepatitis C infection elaborated and regularly updated. So a lot of activities and lot of researches are conducting by the Lugar Center. We are trying through different studies funded by CDC and other our donors, so we are trying to strengthen the viral hepatitis surveillance. In 2021, WHO, in partnership with CDC, conducted an orientation meeting to introduce viral hepatitis elimination validation instrument. Georgia was one of the first countries to implement the instrument. In 2000, Georgia has reached regional targets for control of hepatitis B through immunization by WHO. So HCV elimination program has been a big driver for health system strengthening and advancing the general public health agenda in Georgia. HCV elimination program stimulates the development of other key public health programs such as Safe Blood, infection control, harm reduction, HIV and TB programs. Partnership in Georgia HCV elimination program is expanding, including the support of the organizations such as CDC, WHO, World Hepatitis Alliance, EASL, etc. Lessons learned from the Georgia elimination program can inform programs in other countries striving to eliminate HCV as a public health threat. So I would like just to share some information about the international recognition. I'm really proud of this, that's why I like these slides very much. Yeah. So the first, Georgia was awarded the title of visionary for the European region at the World Hepatitis Summit in Sao Paulo, Brazil in 2017. Then in April 2019, EASL meeting in Vienna was dedicated to Georgia elimination program, and country was awarded with the status of the Center of Excellence. In 2020, so we received a recognition by the CDC director, Honor Award for Excellence in Partnering. And finally, in 2020, NCDC was National Center for Disease Control and Public Health, was designated by WHO as a called WHO Collaborating Center for the Elimination of Viral Hepatitis, and will serve as a demonstration platform for the European region on the topic. So as a WHO Collaborating Center, we will work in two main directions: to assist WHO is supporting member states for developing, revising, and monitoring national hepatitis elimination action plans. And the second is mainly to assist WHO in supporting member states for improving national viral hepatitis testing strategies and strengthen diagnostic laboratory capacity. So just briefly about our, that's the program is very successful, but we still have a lot of things to do. And so just a few words about the next step. As I mentioned before, so we need to targeting interventions for linkage to care of 20,000 anti-HCV positive and 15,000 conflict not linked to care. We still need to strengthen the infection prevention and the control practices in healthcare settings, which has been proven to be vital through the COVID pandemic. We need to develop legislation. Actually, we started to work on this already, to develop legislation for PWIDs to simplify their identification and treatment. As I mentioned, so we decided to expand the program to include hepatitis B elimination. So Ministry of Health has already established a viral hepatitis board, and so this board is responsible to coordinate all activities regarding viral hepatitis. And we have these board members are not only local experts, but representatives from CDC, from WHO, from different organizations. And so soon we probably will have short-term action plan for the management of hepatitis B in the country. So future activities. So we continue to strengthen viral hepatitis surveillance. For example, we established the sentinel surveillance in the country. So we need to find the loss to follow up and link to them to the program. We just finished the pilot study to implement this hepatitis C self-testing model in the country, and so we have just preliminary results. And so we are working on elimination of mother-to-child transmission of HIV, HPV, and syphilis in Georgia, and we are planning to submit to the WHO for triple elimination. So we I've almost finished a study to assess the burden of hepatitis B and C among dentists in Georgia. We continue to work to improve our electronic system, so through public health data modernization project, so funded by CDC, and so just some targeted actions regarding to key populations, because so as we are working to find the innovative ways how to cover, how to increase the screening and linkage to care. There's some shorter plans, and so these are already under discussions, and probably next month will be all these activities will be approved by the Minister of Health. So like to provide HB vaccination to the high-risk population, so provision of testing for harm reduction network beneficiaries, for HCV, HPV, HIV, and syphilis infections twice a year. So simplification of HCV treatment provisions in 4 harm reduction centers. Actually, we had, and so we are planning to expand this in 2 more harm reduction centers and help this key population, I mean mainly to PWIDs, to have all services in one place, starting from screening to the treatment. We are also working to integrate all these services together, so in all primary health care facilities in the whole countries. So what else? So, still we have some problems with reinfection, and so now mainly among the PWIDs, and now they will be able to get the next round of, second round of treatment for free for this population. And screening and all these services. And we are planning to pilot the initiation of HPV treatment among these groups as well. So I want to use this opportunity and so acknowledge to all our partners, as you can see on this slide. And so I would like just to say special thanks to Dr. Ward. So maybe most of you do not know that. So Dr. Ward was from the very beginning involved in the Hep C elimination program in Georgia from 2050 as a chair of technical advisory group. And so we really appreciate your invaluable contribution to the successful development of this program. And plus, I want to say thank you also to use this chance and to our very close partners from CDC and from WHO. Yeah, and so we absolutely agree. So your slogan, working together, we will achieve elimination. Thank you.
Fantastic work. Really a model program for the whole world. Any comments from anyone? One area that strikes me is that you had a goal for 2020. You made great progress, but you didn't reach that goal, so you had to set a new goal. And I hear oftentimes where people are saying, well, our country's not on track, to reach elimination, and we're going to fail before we even get started. But yet, when you look at disease elimination, the goal, the reason you have goals is to, create a sense of urgency, track progress to see how well you're doing, bring people to the table. So I'm interested to see how did you have any, how did you sort of transition, your political leadership and the whole effort toward moving toward new goals? Was it that difficult, or was it that you already had people buying into elimination so everybody understood that you had to stay the course and keep on with new targets? Can you give us any perspectives on that, please?
Okay, so thank you. So something wrong.
I think it's better now.
Yeah,
yeah.
Better. So when I started, I said that was even from the beginning very ambitious goal. But I hope that as experts say, not only my opinion, we are on track to elimination. That's actually, we did a lot, and so our colleagues, also, of course, we are very thankful to our colleagues, Georgian colleagues, because they did a lot, they contributed a lot, physicians, public health personnel, and so on, and ministry, of course. So political commitment, even you remember, Dr. Ward, that was really on a high level, right? And that's why I supported for successful development of this program. Not only that, but so that was one very important tool. Then the during the pandemic, that was kind of as everywhere and everything, so everything just decreased, and screening and so on and so on. The number in treatment, but so as you ask about the new management, we have new management just 2 years ago at the Ministry of Health, and we are really happy to say that. So we see the same commitment, because the minister is very, very interested in successful development of this project. And so he always mentioned in different forum and different meetings. And so even internally, we had several meetings. Even he is very interested to support not only HCV, but HPV elimination, and provide a free treatment for infected population.
Oh, we have comments. Okay, there.
Thank you, Senan Hadanagi, CDC. Thank you, Maia, for a great presentation. I work very closely in this project, but it's always great to see this progress. But I have one question related maybe to colleagues from Ukraine and then colleagues from Moldova. I know Georgia also has quite a large population of internally displaced people from the war from 2008 with Russia, from Abkhazia and South Ossetia. So maybe few comments from your side. Were there any challenges of reaching that groups of people, and also maybe also some successes, because I know some studies have been done there. So how did you approach that, and what is the status with this population and their access to hepatitis C treatment and care? Thank you.
Okay. So they are, since then, so then the problem started. So since then, the Georgian government, of course, tried to help all refugees from Ukraine. So we have, as I remember, so we have free treatment program for HIV and tuberculosis, for free immunization, vaccination, emergency care, but unfortunately, we cannot enroll them in hepatitis C treatment. So because the medicines are available only for Georgian citizens. So I don't know, so later maybe, so negotiations between the Gilead and our government, and so what will happen, but so currently, unfortunately, it's a reality.
Thank you very much for a really nice presentation, and it's good to see update from Georgia over many years. Naveed Janua from British Columbia Center for Disease Control. I have a few questions. So first one, which regimens are currently being used in the treatment program? The second one is, who pays for a confirmatory test, especially SVR assessment? As we see that in many countries, people don't come back for SVR assessment. Is that related to cost issues, or there is some other reason for that?
So for all diagnostics pays government, starting from screening to SVR tests. So it's free. But it was not free from the beginning. So it's free from 2019. Yes, all diagnostic tests, monitoring, and so SVRs and so. And so you are asking about regimen. So we use now soposbuvir, velpatasvir.
So thank you. My name is Danjuma. I'm the president of the World Hepatitis Alliance. And thank you so much for being generous, acknowledging our partnerships. And I know the World Hepatitis Alliance has really done a lot collaborating with Georgia. And as an advocacy group, we've had a lot of success stories from different countries on how they got what we are looking for in terms of political will and political action. So could you share with us what were the key drivers that got the key government officials to be motivated to invest so much into the hepatitis elimination? That's number one. Then number two, I saw your presentation on provision of HPV vaccination. So I may be curious to know, do you plan to do mass general population vaccine, or do you have key populations in mind? And then interested to really see the piloting initiation of HBV treatment among high-risk population with advanced levels of liver fibrosis. That's also an area the Alliance will be very interested to know the progress of that. So most importantly, as I said, congratulations, well done. So we want to know, as an advocacy group and maybe as a lesson to everyone, how did you got the government of Georgia right from the start to commit so much into this and keeping traction, like John did ask. Ambitious goal, yes, you are still able to push, and then you moved the bar, and then you're still on track towards elimination of hepatitis. Thank you.
Okay, so first of all, so just a long time ago, the question was, so why Georgia? Yeah, why Georgia? And that was decided, and so that issue was negotiated and discussed with on a very high level in Georgia. From the I mean, even Prime Minister was involved, and high management from CDC, from Gilead, and so, and WHO, and so. But why this? It was decided. So first of all, we had a very high prevalence of HCV. Then Georgia was a very small country. That's about 4 million population. Then we had very well, based on assessment, of course, this all these experts, that Georgia has very well established infrastructure of treatment and screening of HIV and TB. So I mean, so we had very good qualified physicians. And the political commitment was very high, and so all of them decided to show the world that elimination, HCV elimination is possible. And so when I mentioned the ambitious goal, so not the goal was ambitious, the Georgians are themselves very ambitious, and that's why they decided to be first on the road to elimination. Yeah, that's one question. Yeah, right. So, and I want, yeah, and I maybe I missed that, but it's a very important thing I want to say, that NCDC supported establishment of Cured Patients Association, and that was really very important. So when, and again, this was based on technical advisory group recommendation, and this group is still actively, so they some period, but so during pandemic, but so we are very actively involved in these activities, along, of course, with the governmental structure. And
okay, so yeah, the HPV vaccination.
Vaccination.
Yeah.
Yeah. So free vaccination now is under discussion for key populations and yeah, medical personnel. Yeah. Only, yeah, not now for general population, but this also under discussion because the vaccination and screening and treatment. So to have a free access, but let's see. So next month we'll, yeah.
Yeah, a lot to talk about here. We can talk later. A lot to talk about. Yeah, I've done a great job in Georgia. I think the other key lesson from Georgia is that with some external investment, such as with a pharmaceutical company giving some a drug donation, really spurred that national commitment and spurred national investment in the program, because the national government is certainly putting more resources into the program than they did on day one. When you say,
can you just repeat?
I'm just saying that because of the external support for the program to start it,
yep.
The national government began to help build it with more resources.
Exactly. Yeah, that's why that decision was made to, it was a bit late, but so at least better late than, so, and since 2018, and actually also based on lessons learned, that if you want to achieve elimination, of course, it's better to offer free services to the population. That's why now we are discussing, when we are talking about the hepatitis B elimination, so we explaining them that it's better to provide free services from the beginning.
Very good.
Yeah.
Thank you. Thank you. Thank you again. Thanks, Maia.